The first one is the education sector. Altogether in that sector, there are 582,000 people. That's the public and the private basic education sector, including all those employed on Purcell, the SGBs, and the private educators. Many of these people have already been vaccinated, some because they're over 60 and some because they work as psychologists and others who are registered as healthcare workers. But the majority of people obviously still need to be vaccinated. The program is designed to, with a major thrust that should be over within 10 days, 10 working days, and all the provincial health departments and provincial education departments are going to focus on vaccinating educators in this period. The Department of Basic Education is organizing that schools, the staff of the schools go to the designated vaccination sites for this program, and will be arranging transport to enable them to get to those specific sites. It's a very specific program. It's not the normal program for the general community. And we're just asking teachers and the other staff in the education sector, when they're called to the vaccination site, to remember to take their ID documents and their medical aid if they are a medical aid member. The second major program that is now in an advanced stage of planning and will roll out pretty much immediately upon completion of the teachers is the security cluster, starting with the police services, which planning is in an advanced stage. The South African Police Service is working together with PolMed and GEMS. About 145,000 people are covered through the Police Act and a further 36,000 through the Public Service Act. Those are the civilians working in the police services. So there will be sites at police stations. They are working together with pharmacies who have licenses and are designated points for the delivery of the vaccines. And there's a service provider working with the South African Police Services for vaccinating members. And there's a service provider working with the Department of Public Service and Administration and GEMS for the other workers. Finally, there's also a program that is rolling at the moment for the South African Defence Force and for correctional services. Each one of them has got a different set of needs. The Defence Force are clearly the uniform members in terms of the Defence Act. And fortunately, the Defence Force has its own military health services, so they will be vaccinating their own members, whereas in the corrections, the inmates will be vaccinated through the public, through the correction services, but the staff will be vaccinated through the same program that is run by the Department of Public Service and Administration with GEMS.